Hemangioma classically presents as small, erythematous vascular papules. These lesions appear much like those in the schematic on the right-hand side of the presentation, where you can clearly see these red, vascular papules scattered on the surface of the skin. It is important to note that another name for the cherry angioma is the senile hemangioma. Senile is derived from the Latin word senilis, which means of old age, and therefore it should be no surprise to us that cherry angiomas increase in size and increase in number with age. The pathophysiology of the cherry angioma is a benign blood vessel proliferation, and I would like to emphasize here the benign nature of these lesions, as this will be important on the coming slide. The diagnosis of a cherry angioma is ultimately clinical, as these have a very characteristic appearance on physical exam of these red vascular papules. And as we hinted at on the previous slide, in order to manage these patients, we simply assure them that their cherry angiomas are indeed benign. No further management is therefore required, at least from a medical perspective. Moving on to the second of our two lesions, we have the strawberry hemangioma. This presents as a well-demarcated erythematous plaque, and we have an excellent example at the bottom of our slide where we can clearly see this well-demarcated erythematous plaque immediately superior to this patient's belly button. It should be noted that although strawberry hemangiomas are usually erythematous, they may be more violaceous in appearance if they are deeper and penetrate into the dermis. Another name for strawberry hemangioma is an infantile hemangioma. In contrast to cherry angiomas, which increase in size and frequency over the course of a patient's life, a strawberry hemangioma appears in the first weeks of life. In addition, the strawberry hemangioma is marked by a period of rapid initial growth. However, the strawberry hemangioma then spontaneously regresses by 5 to 9 years of age, or even sooner depending on the patient. In this period of rapid initial growth, followed by spontaneous regression with age, is a principle that frequently shows up on examinations. In terms of pathophysiology, a strawberry hemangioma is a benign capillary proliferation. The diagnosis, given the characteristic clinical appearance of a strawberry hemangioma, is going to be clinical. No biopsy or further testing is generally required. In terms of management, for the majority of our patients, we can simply monitor the strawberry hemangioma and wait for its spontaneous resolution. As we noted on the previous slide, these lesions have a period of initial rapid growth, followed by spontaneous resolution. However, it must be noted that in certain situations, such as in the presence of visual impairment, airway impairment, or in patients who have very cosmetically disfiguring lesions, we must proceed with medical therapy. The standard of care in this case is the use of a beta blocker. In pediatric dermatology, you may see the use of either propranolol or atenolol. Propranolol has long been the gold standard for the treatment of strawberry hemangioma. However, for infants who may have been preterm and have heart problems or pulmonary issues, such as bronchopulmonary dysplasia, using a more selective beta blocker, such as atenolol, can be helpful. Just to emphasize the importance of medical treatment in some cases of strawberry hemangioma, we can see in this schematic representation of an infant with a strawberry hemangioma that this particular lesion is very close to the patient's line of vision. It is not difficult to imagine that with continued growth of this lesion, it may end up disrupting the infant's visual pathway. This can ultimately lead to strabismus and other issues as the infant begins to develop his or her visual systems and representations of the world. Therefore, it is really worth re-emphasizing that in patients with the potential for visual or airway impairment, that we should proceed with the use of a beta blocker. Other potential treatments that you may see used clinically in a dermatologic setting include the use of laser treatments in order to make the lesions less red and noticeable, as well as surgical excision in select cases, particularly for strawberry hemangiomas that are around the eye and eyelid. In conclusion, we've made some significant strides in comparing and contrasting the cherry angioma and strawberry hemangioma. If you can remember that cherry angiomas are also known as senile hemangiomas, and that strawberry hemangiomas are known as infantile hemangiomas, then you are well on your way to mastering these two conditions.